Thank you, Mr. Johnson.
Thank you.
Thank you. Thank you, Mr. Chairman. I lay before the committee an amendment, it's amendment number 8, to protect seniors and individuals with disabilities from the politics of health care repeal. I understand that an election has just taken place and that this bill is a priority of our new Republican majority. However, now is the time to have an adult conversation about this law's provisions and their impact on real people's lives. The amendment I present today simply states that this Congress must certify to the American people before this repeal takes effect that we will not raise costs for seniors, that we will not eliminate preventive care for seniors, and that we will not increase Medicare fraud. Whatever else we do, I believe we must protect seniors in the donut hole from massive prescription drug bills, allow them free checkups and screenings the law affords, and protect the new tools given to CMS and the FBI to fight Medicare fraud. Mr. and Mrs. Glassman of Delray Beach are two of the over 20,000 seniors in my district who fall into the donut hole annually. Despite faithfully paying their Part D premiums, the costs of the medications prescribed by their physicians have skyrocketed. The Affordable Care Act is sparing the Glassmans and millions of seniors like them from bearing the full brunt of runaway prescription drug bills. My amendment would protect them from the politics of this repeal and the reopening of the Medicare donut hole. I'll never forget standing in line behind an elderly gentleman at a pharmacy back in my district before I was a member of Congress. The pharmacist prepared his prescription, bagged it up, and put it on the counter. As the prescription was rung up, the man asked if the price was correct. The pharmacist said that it was. He then pushed the bag back across the counter, turned around, and walked right out of the pharmacy without his drugs. Pharmacist explained to me that he didn't know that he had hit the donut hole and that his monthly prescription price had quadrupled. This gentleman would go without his heart medicine for the rest of the year. This tragic scene, far too common in pharmacies across our country, will end as the Affordable Care Act closes the donut hole. Every time a senior forgoes his or her medication because of its cost, the risk of a more serious and more costly illness increases. Seniors cannot afford reopening the donut hole. My amendment also protects the popular provisions in the Affordable Care Act providing seniors with free checkups and screenings from primary care doctors. This is good policy, plain and simple, because it promotes wellness and it will lower health care costs by catching illnesses before they get serious and potentially life-threatening. This benefit, which began just this week, will save lives. We must spare our seniors from the politics of health care repeal. Finally, the South Florida community I represent is home to some of the worst abusers of Medicare in America. These modern-day marauders prey on our seniors. They disguise themselves as medical suppliers. They bill Medicare for services never provided. In some cases, they deprive the elderly of needed care. No one here today, Democrat or Republican, believes that America's taxpayers should be subsidizing fraud in the Medicare system. Yet that's what this body will be condoning if we repeal the health care bill. Just last month, officials uncovered a drug scam in South Florida that stole over $30 million from our taxpayers. These peddlers were flagged for billing Medicare quantities of a medication that far surpassed what the drug company manufactured. Perhaps Peter Budetti, a deputy administrator for CMS, said it best, commenting on this latest scam. We are now enhancing the tools and the technology we have to stay ahead of the criminals and to identify their patterns of behavior early instead of waiting until a fraudulent payment is long out the door, then trying to chase it down and recover the funds. Under the Affordable Care Act, CMS will be able to pre-screen Medicare providers and see red flags before criminals walk away with taxpayer dollars. Why strip our law enforcement officials of these new tools just as they are making real headway? Medicare fraud costs taxpayers at least $60 billion a year. If we end all fraud and abuse tomorrow, our 10-year deficit could be reduced by over $1 trillion. This amendment would protect fraud prevention and deficit reduction from the political spectacle of repealing health care. An opportunity lies before this committee to keep the donut hole closed, protect preventive care for seniors, make Medicare more efficient and effective, safeguard taxpayer dollars, and reduce the deficit. I urge the committee to make my amendment in order.
Thank you.